Okay. Hi, everyone. I'm Derek. I'm a postdoctoral fellow and ONDRI Scholar at the Rodman Research Institute at Baycrest Health Sciences. And I'm going to be talking about study partners' experiences. Effectively, the relationships that we're seeing between informal caregiving and different clinical characteristics of participants. Before I go forward, I want to thank the ONDRI team of researchers, clinicians, and scientists that are part of this project. So what is the motivation behind this work? Well, we know that many study partners in ONDRI provide informal care. Provide informal care. And we do know from the broader research literature that informal care comes with certain types of costs. These costs can be social and personal, like exhaustion or worrying about levels of care now and in the future, as well as the health and well-being both of the study partner and caregiver and a patient, and economic and financial. With some informal caregiving, we can have lost wages or time off the job, which can further impact health. But by 2030, we're expecting a twofold increase of persons with dementia. But this translates to a bigger problem in the health system, especially through both caregiving and patient, the unit together, to an eightfold increase in the total cost. So what can ONDRI tell us about some of these caregiving relationships? And what can we do about it? Well, within ONDRI, we can measure the impact of some of these things on participants and their families and friends, as well as discovering some of the differences between caregiving across symptoms or diagnoses. And by the end of this, with the findings, we can maybe inform how to better direct different types of resources. So the ONDRI project, as we've seen a little bit already, has 520 participants across multiple diagnoses. And as a requirement, all of the individuals in the project had to have a study partner. And that study partner was required to know the participant very well, with frequent and regular interactions, so that they could also help provide information on the everyday symptoms of the participants. This could include physical, psychological, social, or other states of well-being and health throughout the time course of the project. And there are two measures in particular that I'm going to focus on here. The first is something called the Zaret's Caregiving Burdens Survey. This is an outdated term, so you'll hear me refer to this more so as concerns and experiences of the study partner. And the Neuropsychiatric Inventory, which is another instrument filled out by the study partners and caregivers, where they rate the presence and severity of different symptoms, neuropsychiatric symptoms such as anxiety or nervousness, depression or sadness, or hallucinations, so something that may be seen or heard that is not actually there. So who are the study partners within the ONDRI project? There are a wide variety of different individuals that have joined up. We have siblings and parents, friends, children, but primarily we're seeing that the majority of study partners are spousal partners. And we do see that there's an overall increase of concerns associated with the presence and severity of different symptoms. So here on this graph, I'll direct us to this small pink dot. When the presence or severity of these neuropsychiatric symptoms are low, caregivers and study partners tend to have a smaller amount of overall concerns about what to do and how to care. But we do see effects where this green dot here indicates a higher level of presence and severity of different symptoms, and the study partners are unsure of what to do. Their concerns are increased throughout this project. We do see some small effects of differences between the different cohorts. Now, while we are seeing some overall effects between different diagnostic groups and different symptoms and severity of symptoms, the story is far more nuanced than this. What we found in the study so far is something that reflects who we are. We are different people. We respond to different things in different ways. And we've detected different types of concerns by the study partners and caregivers. One of them is partner-participant strains, another is social, family, and job obligations, followed by an uncertainty or unsureness about how to provide care, and a desire or want to provide better care. And each of these dots here are one of our study partners. The further away from the middle, the higher the expression of these types of concerns. So what is it we can take away from the Study Partner Concerns Project? We do see overall increases of concerns of study partners and caregivers with symptoms. as well as some differences with some of the groups. But it's really not the whole story. As I noted, this is a little bit more complex than that. We know that there are 4 types of these concerns, but we don't know why yet. We have a lot of data, as we've seen in some of the talks so far. We have demographics data. This might be related to income or just access to materials and different resources. But we can also use this as a way to understand more about the patient-family unit. We have a lot of data. These are just at baseline, and we've been following everyone for over 2 years. And we can take all of this stuff together, the genes, brains, behavior, and study partner measures, and put them together to understand a lot more about who we are in these families. So what can we do with some of these findings? We can use this information to help position ourselves for better education and advocacy for all the patients and their relations. We can also discuss different ways of funding and resources and allocation when it comes to health and research, especially to address not just the patient or the family member, but together as a single unit. And we can help inform better outreach. As we saw at the beginning, we have the Ontario Brain Institute's Patient and Community Advisory Committee, and a number of organizations that we've been working with in the ONDRI project, and there are representatives here and tables in the back for heart and stroke, Alzheimer's, and ALS. So with that, I would like to thank a lot of people, the working group that helped put together this study, the ONDRI project, the Ontario Brain Institute, all of our participants and study partners, the Patient Advocacy Committee, and all of you that are here today. Thanks.